Before I start, I'd just like to acknowledge the people of the Kulin Nations on whose land we're gathered today, and I pay my respect to their elders past and present. And I'll say I'm a bit nervous because it doesn't matter if I'm presenting to a room full of strangers, but now you're my colleagues, so bear with me, please. The first thing I'd like to do is acknowledge some of the sources of my information in this presentation. AFES, which is the Institute of Family Studies, specifically Child Family Community Australia, provide a lot of information around child protection and working with families. So a lot of the resources and references that I'll use are drawn from there. Also, a group of colleagues at the Institute of Child Protection Studies at ACU have done some work looking at linking data and child protection, linking alcohol and drug and child protection approaches. So I'd like to start out with this. Most of us would be familiar with this statement, and it's almost become cliche. And part of the reason is probably because few of us could argue that that's the case. It really does take a village to have children grow up to be healthy and well adults. This document is part of the National Framework for Protecting Australia's Children. It's a framework that aims to improve our response to child protection concerns. And in the framework, it calls for a wider approach to child protection. Basically, what they're trying to say is that a child protection approach has to come from a much broader base than just the formal child protection agencies, the statutory state departments. The framework goes on to talk about a range of different areas and interests, like a unified approach across different state jurisdictions, because it's the responsibility for child protection sits within each state. We've got different ways of responding and even different definitions of what child abuse is. Ways to keep children safe in out-of-home care, how to manage the burden between investigating child protection risk and then responding to families that need help when resources, both human and money, are finite. For today, though, I just want to focus on the recognition of the need to have adult-focused services identify and respond to children at risk. That concept that child protection is everyone's business. Now, I think I saw some people up the back there have this look on their face. So, to be honest, I don't blame you. How can anyone who works in alcohol and drug be an expert in child protection? So my aim today is to give you a better understanding of what the current thinking is around child protection, how we work with child protection, what the current how you would go about engaging with child protection, and how you can feel informed around child maltreatment. So before I get started, as Belinda said, I've come from a very child-focused background, pediatric nursing and child injury prevention. I have not worked in the mental health or the alcohol and drug sector. So what I'm trying to do is provide you some context around the child protection area. And if I say something where I've used the wrong terminology or it sounds like I'm trying to tell you to do your work, please bear with me and come tap me on the shoulder afterwards and tell me how it really works. I won't be offended. I'm keen to learn. So we'll start with the historical context about child protection. And the first thing we know about child protection historically is that children were initially considered the chattels of their parents. We saw things like child labor, the concept of children in early Victorian era was that children were to be seen and not heard. In the 1870s, this little girl, Mary Ellen McCormick, her parents died, and her father died, and her mother couldn't afford to keep her, and so she was surrendered to an orphanage where she was adopted to a family. Her adoptive father died soon after she moved in with them, and her adoptive mother became very cruel to her. Eventually, the neighbors recounted stories of her being whipped, hit with scissors, horrible injuries that they were seeing with her. And they complained to the Department of Public Charities and Corrections. A woman there called Etta Wheeler took up her case and tried to figure out how she could deal with this. And she discovered there were no laws to protect children. So in order to respond to Mary Ellen's need, she went to the American Society for the Prevention of Child Abuse. The American Society for the Prevention of Cruelty to Animals. And they took up her cause. Her adoptive mother was eventually charged with assault and battery, and Etta offered to raise Mary Ellen. And apparently she grew up to be a loving and caring mother once she got into a decent home. This case led to the foundation of the New York Society for the Prevention of Cruelty to Children. And over time, Australia founded its own child protection agencies, so the New South Wales Society for Prevention of Cruelty to Children, and then later in 1894, the Victorian. Over time, some colleagues in the US, some radiologist and pediatrician, identified a constellation of odd injuries in children. They noticed that a few children were presenting with head injuries, specifically subdural hematoma, and fractures in their long bones. They called this the battered child syndrome and published this paper in the American Journal of the Medical Association. Now, this was considered to be the tipping point for child protection. This is when child protection became a clinical issue. And many consider it the point that the modern day child protection system evolved. So when you read this paper, the thing that I found most important and the most salient message was how concerned these doctors were that any parent could inflict this kind of damage on a child. And the only way they could understand or explain this was to say that it was clearly due to mental health or personality defects in the parent. So that was where the whole process started. Over time, we've taken a broader view of what child maltreatment is. It's no longer just about physical abuse, and it's certainly much more than the co-occurrence of head injury and fractures. So for a start, you'll note that I don't use the term child abuse, we use child maltreatment, because maltreatment includes abuse and neglect, which is a relatively new concept. So we speak of that combination as maltreatment. Now, if you ask me what exactly is child maltreatment, there doesn't seem to be a universal definition. It depends on who you're talking to, whether it's a formal child protection agency or someone who works to prevent child abuse or child neglect. The definitions vary across jurisdictions and across different paradigms of people who work through it. But what this slide gives you is what the minimum expectations are about parenting to keep children safe and to allow them to grow up healthy and well. So we know that good enough parenting involves minimizing environmental risk so that the house is clean and that they're relatively safe from injury. That they have physical safety, that children are provided with food, with medical care, and with good personal hygiene. That their emotional needs are met, so support and nurturing them. And that their developmental needs are met. Before school age, this might mean simply attachment and cuddling and loving, but after they get into school age, then provision of education. Each jurisdiction in Australia, as I said, has a different legislative response to child protection. Each state is responsible for their own child protection. So I'm not going to go into all of the different legislative differences across the different states. In Victoria, this is what determines whether or not a child is in need of protection. So there's two things really to notice on this slide. First of all is that the child has to be at risk of significant harm. So I'm not talking about just nits in their hair or the likelihood that maybe once in a blue moon the child walks out a door onto a playground or something unsupervised, or maybe for a week mum is unwell with the flu and doesn't cook appropriate meals and they're eating beans on toast every day. I'm talking about long-term serious effects. The other thing that's really important about this legislation is before child protection can intervene, before a child is deemed to be in need of a response from child protection, they have to determine that they don't have a parent or guardian who's able and willing to protect them. If, say, in a family violence situation, you've got a mum who is protecting the child, then a child won't be removed because the mum is deemed to be able and capable of protecting them. Even though she's protecting them from the father, she is protective. In some homes, children don't have either parent who are able to do that. And so that's when child protection intervenes. Now, I'll say from the outset, we tend to think of child protection as just a body that comes in and removes children. And I've done a fair bit of work with people who work in this area, and that's not what child protections want to see happen. Ultimately, they want children to stay in their homes because that's what we know is best for them. Sometimes they have to remove children, and it's always a very tough decision, and it's always a very difficult thing to do. But their focus is on the well-being of the child, so their approach has to be to keep that child safe. Now this gives us an indication of how big the problem is. If you look, the top of the slide is about notifications. So this is people who've identified children who might be at risk of child maltreatment. So someone who's concerned about a child, a doctor, a nurse, a teacher, yourself, rings child protection and says, I'm concerned about this child. And in the AIHW collates these statistics, and in the past calendar year, 14-15, there were 320,000 notifications for children. Now, it was about 218,000 children that those notifications were. So some children were clearly being notified more than once. That gives us a rate of 39.2 children per 1,000 children who were deemed at some stage by someone to be at risk of maltreatment. What child protection then does is go out and investigate and determine, are these children really in need of protection? Do they meet that threshold? So they investigated 107,000 children, but 152,000 investigations. So again, children being investigated multiple times. So 20 children per 1,000. And for 42,000 of those children, they were deemed that there wasn't a big enough issue that child protection needed to step in, so that the abuse or the maltreatment was substantiated. There were 11,000, just over 11,000 children who were admitted to out-of-home care, and that left us with 52,000 who are actually currently in out-of-home care at the end of 2014-15. And that's a rate of 8.1 children per 1,000 children. So something of interest is 37% of those children come from the lowest socioeconomic group. Now we can look at different types of child maltreatment, and I have no slides in here that will cause anyone to be upset in terms of horrible pictures or anything. This is as bad as it gets with these x-rays, so please don't worry that something's going to suddenly pop up and assault you. Physical abuse, as Kemp and his colleagues identified, was often associated with fractures in the long bones and a head injury. And we define physical abuse as anything where physical force results in harm to the child. Now this can include corporal punishment that can be deemed maltreatment if it's causing serious harm to the child. Shaking a baby, so you've all heard of shaken baby syndrome, where a parent in frustration shakes a child. Hitting, punching, kicking, poisoning. And well, it sounds reasonably straightforward to identify this. It isn't. So I want you to think, if you were a clinician in an emergency department and a child presents with a fractured arm, can you tell from that fracture whether he fell or whether he was pushed? And how can you be sure? So some things are reasonably easy to identify, or they set off alarm bells. There's certain types of fractures that the x-rays will show they required a turning force as well as a breaking force. So we call them bucket handle fractures, and you'll see it looks like a bucket handle where part of the bone is broken away around the edge. Those tend to be associated just with child maltreatment. Not all the time, but mostly. Sometimes parents will say that a child has rolled off a bed, so they'll come in and say, my 4-week-old rolled off the middle of my queen-size bed, and that's why they have a fractured skull. 4-week-old children don't normally roll. It's possible they may roll, or they may have wiggled to the edge of the bed, but it's unlikely. So those kinds of things set up concerns in clinicians. Children who present with bruises to areas that aren't likely to be struck against something, so to the back of their thighs, that kind of thing, it's unlikely that it just would have happened from them knocking it. So what I'm trying to reinforce here is that while we think we understand what this is, really people who work in this area work in grey. Sexual abuse, the use of a child for sexual gratification by an adult or a significantly older child. Now clearly we all know that some stuff is sexual abuse. For example, a parent-child sexual relationship. There's no doubt about that being wrong. But some things for you to consider, some examples of things that have been before the courts and that people have had to consider whether or not they're sexual abuse. A 17-year-old boy and a 15-year-old girl were dating. He turned 18, she hadn't yet turned 16, and they slept together. Her father found out and reported him to the authorities. So now she's below the age of consent, and he's no longer considered a child, he's now an adult. Is that sexual abuse? By the law's eyes, technically it is. But the judge, when he heard that case, he had to find that it was abuse, but he didn't register the boy as on the sexual offenders register, and identified that there had been an ongoing relationship, so it wasn't necessarily a power imbalance. So something else, a 22-year-old piano teacher and an 18-year-old student. Does it matter if the teacher is the 22-year-old and the student is the 18-year-old? Does that power balance change with that? What if it's a math teacher and a student? So then there's issues of consent and coercion that sit underneath the sexual abuse thing too. So if there's two 14-year-olds that are engaging in sexual activity, and it happens, we've seen incidents of children presenting with sexually transmitted diseases as young as 10. So if it's two 14-year-olds, are they even able to consent to understand what they're engaging in? And what if one of them participates out of fear or because they're being bullied? Is that then abuse by the other child? So it's a complex thing to try to get your head around. Exposure to interpersonal violence. Now often we call this family violence, but it doesn't have to be just within the family. So the child doesn't have to be exposed just to the physical act of violence. They don't have to see their father hitting their mother or their two brothers fighting. Just seeing the after effects of that. So a mother who's distressed because the father's, the child's walked in, mom's sitting on the couch crying, and he can see that the father's either verbally or physically abused her, or walking into a room that's been trashed by an older sibling. Those also have an effect. And we recognize the effect of this in returned soldiers, in paramedics, in police. It's the same thing for our children when they're exposed to this violence. So as well as the direct impact of witnessing that, there's also an impact on the parent's ability to care for the child. So a mother who's in an abusive relationship, who knows that every other night her husband is going to come home drunk and belt the daylights out of her, is going to be less able to parent her child, living with that fear. She's focused just on surviving. Being able to nurture that child is going to be a real hard thing for her. So sometimes abuse happens not because a parent wills it to happen, but because they just don't have the capacity to parent properly. Emotional maltreatment, again, this can involve things like rejecting, isolating, terrorizing, ignoring, or corrupting. Some things lean more towards neglect. So if a parent refuses to cuddle a child or ignores a child, it's more neglect. If they're name calling and belittling a child, then it's probably more abuse. And again, some parents just don't have the emotional capacity. If they're wrestling with a mental illness and depression, being able to nurture your child emotionally is a big ask. Neglect is probably the grayest of all of them. It's a hugely complex condition. Mostly in the definitions, we see that neglect is an act of omission, so it's something that isn't provided to a child. It evolves. As knowledge about child well-being improves, so too does our knowledge of neglect. So, for instance, when I was a kid, I used to stand on the front seat beside my grandfather, and we would drive around town. Nobody batted an eye. That's just what we did. It was a long time ago. It wasn't a Model T, but it was a long time ago. Nowadays, if you saw a child standing on a passenger seat in the front seat of a car, you'd be horrified, and it would be well within Child Protection's rights to say, this is neglect. You need to do something. You need to change the way you parent. So with evolving knowledge comes changes to what definition is. Then to further complicate it, the thresholds are subjective. So we know from research that child protection workers who work with a family over a long period of time become conditioned to what that family lives in. So they might stop seeing the level of neglect because they've been working so hard with that family to make the changes. And if they were to take that family on as a new client, they would be inclined to identify it as neglect, but maybe less likely if they've been working through and they've become conditioned to it. Cultural differences also have an impact. In some countries, girl children aren't educated. In Australia, that would be considered neglect. So depending on where you are. Then if you layer issues of poverty over top that, you'll see that neglect becomes further complicated. So if we say that neglect is about failing to provide the necessities of life for children, so food, shelter, clothing, warmth, And poverty is pretty much the same thing. Poverty is an absence of that. So how can you determine whether or not a parent is living in poverty and unable to provide those conditions, or whether they're not doing it even though they should be? So something to, just an example that might be worth thinking about, if you think about a single mom and her rent is overdue, she's being threatened with eviction, she's got 2 or 3 kids, one of the children needs their asthma medication refilled, and they've run out of money to buy milk and groceries before payday. So mom has to make a decision, what's she going to buy? If she decides to buy the milk and bread and pay the rent, and the child then has an asthma attack, is the doctor justified in considering that to be medical neglect? She hasn't provided the necessary preventive care for that child. Black and white, yes. But when you consider all the other circumstances that go with that, it's a bit more complex. So there's different types of neglect based on, I'm trying to juggle here, based on what the child doesn't get. So we have supervisory neglect, where a parent fails to supervise a child. Physical, medical, you can see the different types there are. Emerging types of neglect that we're now seeing in the literature are exposure to guns, particularly in the United States, where guns aren't being locked up or ammunition isn't being locked up and they're left out for children to access. Smoking. In Australia now we have legislation that says you aren't to smoke in a closed vehicle with a child. So that could be considered neglect. There's also some work that's being done in the States where parents who have emotionally neglected a child and the child has committed suicide, where they're considering whether or not those parents should be charged with neglect. So it's complex. There's also other forms of maltreatment that I won't go into too far, but to think about. So fetal abuse, they talk about this particularly in relation to what they call neonatal abstinence syndrome. So drug-addicted babies who were born addicted to medications their mother's been on. Bullying or peer abuse, sibling abuse, so 2 within a family, even witnessing community violence, institutional abuse. That would be, most of us are familiar with the inquiry into institutional sexual abuse, organized exploitation, so child trafficking, and even state-sanctioned abuse. Probably politically incorrect to say so, but keeping children in detention centers where they don't have access to education and things like that could be deemed to be state-sanctioned abuse. Now this gives us an idea of what the different types of abuse and neglect are. And you can see that the most common, the 2 down the right-hand side of the slide, are emotional abuse and neglect. And it's by far and away the largest type of maltreatment that we see. They're also the most likely to co-occur. So child maltreatment seldom occurs in its single form. Where I've been talking about physical abuse or emotional abuse or neglect, that's relatively uncommon. Most often one occurs with another. And most often it's emotional abuse. So 32% of children who have been identified and substantiated for emotional abuse are also substantiated for neglect. And vice versa, 28% of children who are identified as being neglected also have a component of emotional maltreatment. So the impact of maltreatment is quite significant. They use the term complex trauma to describe the effect that it has on children, and depending on the age and developmental stage of the child, it can be quite severe. So generally speaking, the younger a child is, the more likely they are to have serious effects. If the maltreatment is more serious, they're more likely to have serious outcomes. It's worse if the child feels that they're to blame or if they're shamed by what's happened. And also, depending on who the perpetrator is. So some work by Price Robertson's found that in sexual abuse, it's actually worse for the child if the person who's perpetrated the abuse is someone that the child has an intense emotional relationship with. So a father or mother, if they have that strong emotional bond, it's actually worse for that child. And other connected adults can often influence the effect of that trauma too. So how they respond to that trauma. Do they support the child and help nurture them through this, or do they victimize the child or discount it completely? So that also has an impact on what happens. Now, I've divided this up, not so much to read it out to you, but just so you can see that the impacts vary for adults and children, and it's not just something that's fixed once a child grows up. It goes on and persists. The effects of maltreatment persist well into adulthood. Adults who've been maltreated are more likely to be involved in the criminal justice system. They're more likely to have alcohol, drug, and mental health issues. We also now are recognizing intergenerational transmission of child abuse and neglect. So you'll hear about this particularly in context of Indigenous people with the stolen generation, where they talk about how they've been disconnected from their culture and it's affected their parenting. And we see some really strong evidence that this is so. And in its most blatant form, if you think about it, if someone's been maltreated as a child, so someone who, say, was removed from a child and placed in an institution at a very young age and grew up in that institution where they weren't parented properly, if they then have children, they have no model for parenting. So they don't know how to parent a child. And a striking example of this with one of the families that I was working with was a young girl who had her little bub. She was a brand new baby, and the girl that had the baby was about 17. And I was talking to her about some intervention that was being done, a program that was intervening to help her parent. And her comment to me was that the thing she'd learned that was most important to her was that she had to talk to her baby. And she said, they told me I had to talk to my baby. Who knew? They don't talk back or anything. She just had no concept that that was something important that she should do. Her thinking was that she was being a good mom if Bub wasn't crying and he'd been fed and his pants were dry. That's all she needed to do. But she had no other model to work off of. So these are examples of things that can help protect children. And you'll see I've kind of broken it into an ecological environmental model. Bronfenbrenner is the one that developed this way of looking at child maltreatment. And he's saying that different systems exist and child protection sits within those. So there are certain child-related characteristics that can influence whether or not they're likely to be maltreated. So disabled children are more likely to be maltreated than children who are able-bodied. Family, there's different things around family that can affect whether or not a child is maltreated, and the same within the community and society. And we can't isolate any of these. A child lives within a family that lives within the community and society, and you can't just pull one factor out because they're all interconnected. So conversely, these are the risk factors associated with maltreatment, and I don't expect you to read them, but just to get an idea that it's quite significant. And something that you might notice because of the sector that you're working in is that a lot of these risks are the same risks that go with alcohol and drug abuse. Misuse, I got it. So people who have alcohol and drug issues also have been exposed to many of the similar risk factors that maltreated people have. Some work done by MacArthur and Winkworth out of ACU has identified that 60,000 Australian children have a parent currently attending some treatment for alcohol misuse. And there's actually many more in the community that are likely to be affected by parents who are using alcohol. More than half of kids reported to child protection authorities live in homes where there is some alcohol or drug misuse. And from a child protection perspective, these are the things that concern the child protection workers when they hear that there are alcohol and drug issues in a home. So alcohol and drug use can affect a child even before birth. Things like fetal alcohol syndrome disorder, where we know there's a whole spectrum and we really don't know what the safe level of consumption of alcohol is for the unborn child. Children who are born with who addicted to substances and have to undergo detox at birth, there's also an impact. It affects the brain development as well, being exposed to these things. Children are at risk of poorer educational outcomes. They're more likely to have behavioral disorders. The parenting lifestyle is more likely to be chaotic. They might be more likely to be associated with criminal acts. Children could be exposed to the drug paraphernalia if it's left around the house. And there's also an impact on family housing. We also see social isolation, family violence, and a higher risk of maltreatment where these things are present. Sorry, my fingers are sticking. We know that the intersect between alcohol and drug and family is quite complex. Where there's alcohol and drug issues, we're more likely to see homelessness, other problems such as violence, mental illness, housing instability, and unemployment. Where there's family violence, we often see alcohol and drug issues. There's links between parents with psychiatric disability and alcohol and drug abuse. And alcohol and drug users are more likely to have contact with child protection services because of financial problems. So it may not even be child protection services, but they're known to the system, and so they're more likely to be brought to child protection's awareness. And there's also links with unemployment and all of that. You're also more likely to be impoverished. So we've got, on top of all of that, to layer onto it, we've got social isolation. So a woman who's been, who's had a problem with addiction, particularly in a small community, is likely to be stigmatized and be dealing with that stigmatization. She's not necessarily inclined to seek help. She's worried about, if she goes for help, will that expose her to the child protection authorities, and will they take her children? When she tries to engage with other families who know that she's been an addict, they're not inclined to let their children play with her. They don't want to engage with her. They're concerned about it. So she's further isolated. And in some of the, where child protection has actually intervened, we see cases where parents are being told, you aren't to make contact with your friends. If you go back and associate with those friends, you're putting your child at risk, and we will have to act. So what happens is, even more, the parents are moved outside of what was their support network, and now they're really on their own. So there's issues around that too. And then, just to add to it, once other services recognize that child protection is involved, they often back off and say, it's child protection's problem now, I don't have to worry, child protection has it. So these families don't get connected to services that they might benefit from because child protection are involved. So now that I've depressed everybody telling them the story, we can talk about what works. We know that child maltreatment has a ripple effect that lives on, and it affects not only the children who are being maltreated, but also their lives as adults, and then how they parent. Waiting until families meet that threshold for intervention is really too late. So the numbers that I showed earlier, they demonstrate just how big the problem is and what child protection is working with. The caseloads that these people manage are huge, and if you've got one child that really needs intensive support, that means that the others are missing out somehow. So trying to juggle that and make sure that everyone who's under your umbrella is safe and cared for is a daily struggle for some of these workers. Sometimes they sail along and there's no issues, and then all of a sudden everybody will have a problem and need lots of help. So this is where you come in. It's about getting early and preventing the maltreatment from occurring, or stopping it early enough that it doesn't get worse. So when I spoke of the national framework, this is the premise that it's built on. This is a public health model for intervening in child protection. And you can see at the bottom, the very bottom part of the pyramid, is a universal, they're talking about universal services. So these are things that are available to all families. You don't have to be identified as needing involvement with the child protection system. It could be things like maternal and child health, nursing, unemployment insurance, all of those things that as a society are available to everyone that support families. For families where we identify that there's a risk, so maybe it's families where parents have alcohol and drug issues, we've got early intervention services. So by intervening with the parents and supporting them and referring them to parenting programs so they can learn how to be better parents while they're dealing with their addiction, we're dealing with them at a secondary level. Then we've got more targeted, as the severity moves up, we've got more targeted intervention. So we've got intensive support services for parents who require it. An example of that would be the Cradle to Kinder program, where they identify young mums who are really at risk of maltreating their children. They're probably in the child maltreatment system themselves. They might be very young. So those really intensive parents that put wraparound services around these parents to teach them how to be good parents before there's a child protection issue. And then finally the statutory system. And these exist across state and government organizations and also some NGOs. So the services are provided at by different services at different times according to need. This looks complicated, and what I want you to note most of all is this is work done by my colleagues again at ACU, and it describes what child-aware services look like in alcohol for anyone who delivers. So up this end, these are services directed at the children. So these are specifically, I've got parents, sorry, that should be child. So the child is the primary client. So they work with the child, they take the child's viewpoint into account, and it's working specifically with the child. Family services, where the parent and the child are the clients. So they'll consider what the child wants, they'll do the best they can for the child, but it isn't necessarily just about the child. And then way over on the other side, adult services. So those are about being sensitive and responsive to children and youth, and just being aware that perhaps a parent who you're dealing with has children, and making sure that that parent has provision to keep those kids safe. Whether it's a neighbor or an aunt or somebody that can assist. If they're having a bad day, they've got someone to go to. Making sure that those children are cared for, and seeing the adult that you're providing services for as part of a family, not just the individual that you deal with. What this comes to is a thing. Now, this model was put together by James Reason, who worked in aircraft safety. So what he's proposed was that preventing an air crash, or in this case we want to talk about child protection or child maltreatment, is reliant on all the slices of cheese with the holes in it, so that none of the holes line up to end up in the child abuse. So by layering the different responses, so by layering those of you who work with the adults in the alcohol and drug sector, by layering your prevention services with the maternal and child health, who works with the school, who might be working with another sector, say a mental health worker, to make sure that those holes never line up and result in abuse. So it's not all your responsibility, but it's about providing a system that allows people a chance to fail at one level, but somebody else might pick it up. So if we go back to the village, drug and alcohol problems don't exist in isolation, and so we can't address them in isolation. And it's the same story for child maltreatment. You can't just look at one and think that's going to fix it. If you think of your adults as family members and build their parenting capacity, we're less likely to see child maltreatment occur. And finally, this is part of the ACE suite of resources. So this is Child Family Community, and it's a clearinghouse. If you want any information on anything to do with families and supporting families and services that are available, or what, if you're wrestling with, is this something I should report, or is this child maltreatment, how can I deal with this? You can subscribe to an alert. They send out an alert. They don't sell your stuff on. You don't get a million emails. It's really, you get what you've subscribed to. But there's also a lot of resources in there that you can go in and search for. And if there's something specific to family support that you want, you can actually contact them and ask them what's available. And they will provide a bibliography for you or help you to get the information you need. So it's a really good resource. The website's at the bottom. If you're not sure, don't hesitate to get in touch, and I can flick you through where to go to get in touch. Is that going to go? Thank you.